Sorry, thank you. I apologize. Um, thank you, and thank you all for joining. For those who are here, I just would like to give a warm welcome to the doctors who took their very, very busy time and this pandemic to join us here. If you would like to introduce yourselves.
Hi, I'm Anthony Harris. I'm an infectious disease physician and what's called the hospital epidemiologist, which basically means we help control the spread of COVID within hospitals and prevent healthcare workers and patients from getting it at the University of Maryland Medical System.
Hey, thank you so much for having us. I'm John Baghdadi. I'm also an infectious disease physician and hospital epidemiologist, and I do infection prevention mainly at the University of Maryland Medical Center Midtown campus, just down the road from my guest.
Thank you so much. We're just gonna give really quick introductions to the people who are working here right now. I'm Sofia Maldonado Feliciano. I am the SVA president. I use she, her pronouns. If Ashton would like to go first.
Hey, yeah, I'm Ashton, they, them pronouns, and I'm the chief of staff for the SVA this year. Cole?
Hey, I'm Cole. I'm the student life VP with SVA, he, him, and it's good to be here. Let's see, Julia.
Hi, I'm Julia, and I'm a graduate student council officer, and I am a graduate student in the curatorial practice program, she, they pronouns, and I'll pass it off to Chloe. Did you go? Yeah, Chloe.
No, but I can. Hi, I'm Chloe Green, she, her pronouns, and I'm the SVA Student Life Membership Chair. I will toss it to Dion.
Hi, Dion Moses, a member of the Graduate Student Council and a second-year curatorial practice student. Samantha P.
Hi, I'm Sam. I am the Vice President of Academic Affairs for SVA. And yeah. Has Andy gone?
I have not. Hi, I'm Andy. I'm the Academic Affairs Secretary. I use he, him pronouns. Who hasn't? Carol?
Hi, everyone. My name is Carol Martinez-Doan. I use they, them, theirs pronoun. I'm the director for the Center for Student Engagement. I'm the advisor to SVA. And Mike?
Sure. Hi, everyone. Mike Patterson, Vice President of Student Affairs. It's good to see you all. Sophia, I'm not sure how far through the room you're trying to go with introductions.
Just the basics for those who are going to be working here.
Okay. Doug, why don't you introduce yourself? Doug should introduce himself as well, though. So,
real quick. Hi, everybody. I'm Doug Mann, Vice President of Operations and Finance, and I've been working with Mike and the epidemiologists on our planning for the spring.
Okay, thank you so much. We're gonna go head down with the more basic questions here. I will head it to Sam.
Andy's actually gonna start us off.
Okay, yeah. My apologies.
Oh, no worries. So our first questions are just like, what do I do if I get COVID? Like what happens in your body if you get COVID, and what do you do about it?
Okay, so I'll handle the medical questions, and then I think Mike is going to handle a little bit about the logistics of what would happen for the 100 students on campus. So for most people, the student's age, the first thing to remember is you're generally going to do well. Okay, so that the mortality rate, as an example, in people your general age is probably 0.5 or 0.25%, extremely small. The rate of hospitalization, meaning if you were to get COVID, what would be the probability or chance of you requiring hospitalization is very small as well, probably at about 2.5 to 5%. So with that background, I think it's in general worthwhile to understand that, it's not going to affect you guys very badly. On the other hand, what I would say is it's more aggressive than influenza. So probably there's a fair number of you who, or a small percentage of you who've had influenza in the past, which means basically you feel like crap, to be honest, for on average, you know, a week. You're going to have symptoms like fever, headache, muscle fatigue. And then the thing that's a little bit tricky with the virus that causes COVID-19, so the virus is called SARS-CoV-2, is there's a bunch of things that we don't know because it's new. So the term long haulers that we've heard about is all kinds of new things we're discovering, unfortunately, about COVID-19 that didn't exist with flu. So things like loss of taste, loss of smell didn't really happen with other viruses, happens with COVID-19. This idea of mental fogginess, where in essence, people can unfortunately for months on end not feel as if their brain is functioning at the same level as it was pre-COVID, are issues. And then I think what's really, really important for most, for students to understand, and especially kind of some of the COVID deniers or COVID minimizers to understand, is that it's super transmissible compared to influenza. So that even if you as a student were to do well, the repercussions of you is spreading it to potentially a parent, a grandparent, a teacher, right? Or someone who's in a higher risk group, and higher risk could be meaning someone who's 40 or 50 with comorbid conditions and them doing poorly. We should not underestimate that. So one of the main important goals that we'll get to is not only how you protect yourself from getting COVID, but how you protect it from spreading. And I think the bottom line for a lot of students that want to come back to campus and want this to be successful, it's almost your social responsibility, not only to prevent yourself from getting it, but prevent you from spreading it to others and leading to a failure kind of the reopening. So there's a lot of social responsibility that goes on with what we'll get to in terms of following rules and wearing masks and you know, spacing and those kind of issues. And to more directly answer your question of from if I get positive and I'm on campus, what's going to happen? I want to pass it over to Michael.
Yeah, thank you, Dr. Harris. And I can say a couple of things. So first of all, Dr. Harris was just talking about the social responsibility. So since we're filming this or recording this right now and we're not yet to the term, if anyone is in the room or sees this before you come to campus and you're planning to come to campus, if you have a COVID test that's positive, if you are waiting for a COVID test because you are a close contact or have symptoms, or you have symptoms, do not come to campus. Stay home. Make sure that you've gotten cleared, make sure you are well, quarantine and listen to your doctors as you need to. Let us know if that means you're coming to campus a little bit later than you were intending. Let us know. We'll work with you. We'll make sure you don't miss anything. But don't come, stay at home if there's any reason to believe you might be actively ill. We will have, as Dr. Harris noted, we're going to have about 100 students and residents, but we will have more students than that engaging the campus regularly. In particular, we're going to have some population of our graduate students and our seniors in and out of studios and shops, and other students as well. So we expect several hundred students engaging the campus in varying ways, shapes, and forms during the semester. As a reminder, anybody who's coming to campus at least once a week, and by the way, that includes all residential students because you're living on campus, you're going to be in our asymptomatic testing program. You're going to be tested once a week. And the schedule for that testing actually came out just this past Friday through Recap. So if you need that schedule, go look at this past Friday's Recap and you'll see how it's broken out for a schedule. But if you take a test, your weekly test, and you come back with a positive result, we're going to kick into gear and put you directly in contact with Student Health Services, and they're going to guide you with what to do. If you are a residential student living on campus, we will have ample quarantine and isolation spaces set aside. Those will be in Carter and Spear for those who are curious and playing along at home. And we will be able to work with you to get you located into a quarantine space for the duration of your illness until you are medically cleared. We will have staff available to assist with things like supplies and food. The health center will be engaging and working with you on a daily basis to help monitor and track and make sure that you're fine. If you're living off campus, you'll need to quarantine and isolate in your location, in your off-campus apartment. But again, our health services team will be in contact with you for support and information and to monitor symptoms daily. The one other thing I'll say, and then I'll step back in case there's any follow-up questions later on, is in addition to the weekly testing, everyone who's on campus should be using the Campus Clear app to check their symptoms daily. I've already started doing that just to get in the habit of doing it. And it's going to give you a big old fat smiley face that says you can come in if you clear, or it says you can't if you don't. And that might not mean you have to go in and suddenly sign up for a test, but it's going to be very cautious. And I'll give you a specific example. One day last week, I woke up and I had a headache for no obvious and discernible reason. So I noted in the app that I had a headache and no other symptoms. And it told me, stay put, do not come into campus. It's going to be cautious. It's going to work to try to protect everyone as best they can. And it's important that everyone accessing the campus physically is doing this on a daily basis to make sure that they are ready to go and there's nothing that we need to worry about.
So maybe I'll quickly add here. I think both Dr. Harris and Mike covered a lot of really important concepts. But one thing that I think should be made clear is most of the people in whom we detect COVID-19, most of the cases we identify where people have COVID-19 infection have a mild symptomatic infection. Much more rarely, but occasionally, some people will progress to severe infection. And then also probably pretty commonly, but underdetected, underidentified, are people who have asymptomatic infections. These are people who don't feel sick, but can infect others, can spread illness, can cause problems. And so, you know, Mike identified all those like very important procedures that we're putting in place to protect you, including symptom screens. But the truth is there still can be a person who feels perfectly fine and has the potential to infect others, which is why it's really important to maintain physical and social distance, keep a mask on when you're close to other people, and sort of follow the precautions.
Thank you. One of the actually things that's a really good segue into our next question, which is, Mike, you mentioned on-campus testing, and I know there are some like concerns about testing. So how quickly can we get results if we are tested, and what does the test that Micah is using, what does it look like, and what would the process be?
I'll give the basics, but the doctors and Doug may want to back me up on some of the medical information here. Micah, first of all, we're mounting our own testing program that will be up and running this coming Tuesday, I think that's the 19th, and our on-campus testing sites in B-Box. We will be testing, next week we'll be testing only Tuesday and Wednesday because campus isn't open Monday, but most weeks we'll be testing Monday through Wednesday. And again, the schedule for those who need to be in the weekly testing program was in recap last week, and we're going to get it up online. Micah's using a PCR nasal swab. So this is the one that has to be observed by a medical professional, but not necessarily administered by a medical professional. In other words, they will watch you to make sure you do it correctly. We are working with the lab, have a contract with the lab where they manage the pickup and delivery of the test, the testing itself, and results are available within 48 hours. And if I remember correctly, Doug, please check me if I'm wrong, because you probably know this better than I do. You're notified of your test results, not by a phone call necessarily, but through a secure medical portal. Although if there's a positive test, we will of course engage you directly as well.
Yeah, Mike, I believe the test results are going back to Judy, or yeah.
So it's a both and. So we're notified behind the scenes of the test results, in particular to be able to engage our folks who test positive. But I'm reasonably confident, and we'll confirm with SVA. But I think individual users are supposed to be getting their results through the online portal as a general rule.
Okay.
So just a couple quick sentences on why that test. And so John and I and an infection preventionist, Joan Hebden, have been working with Micah for a couple months now. And so we've reviewed kind of all aspects. And I just want to reassure you, and I wouldn't say this unless I felt strongly about it, you guys should feel confident that you have really skilled people making these decisions and review and making the protocols. And We've been very impressed with the MICA leadership on this. Relative to the test we chose and helped recommend, they had chosen it already, but we told them it was a good test. The PCR-based test is what we call the gold standard, meaning at this point in time, it's one of the better tests out there. There are other tests that are available that are easier to administer called rapid tests, but they tend to have poor test qualities and basically have more false negatives and more false positives. And so we didn't feel that was a way to go. What some of the students may be concerned about is how far back the swab is actually going. And so it doesn't go to the nasopharyngeal area, which is commonly referred to as students as the back of the brain test. That's not the test that's going to be done. It's just basically in your nose. So it's a combination of a good test with a modality that we think will be acceptable to students. And it's the test that's used widely across the country in a lot of student testing centers.
Thank you very much. Now I'm going to pass it on to Sam.
Hello. Sorry, I had internet issues. So we're on the new strain of COVID, correct, Andy? Yeah, okay. So our next question is, what do you know about the new strain and what is happening about that?
I'll start this one, but with COVID, it's a really fluid situation, and which means that the answers that I give now hopefully will be true for the whole spring semester, but there's a chance that things will change, which is why I think we'll be available throughout to kind of change policies and guidance and help advise as more information is gained. But in general, one of the things that's important to remember is viruses mutate all the time. So that if countries were doing sequencing routinely from the beginning, which some were, you'd see that the virus was constantly mutating. So that a strain that was dominant last February and March in China is not the strain that was dominant in China in, June, July, August. So that when you find mutations in the virus, it's really nothing to be worried about. Now, what people are concerned about with the UK virus and the South African virus is some of these mutations occurred at a key part of the virus that people are worried about. Could this lead to higher transmission is a question. And people are asking, could this theoretically lead to the vaccines no longer being effective? At this moment in time, there's no data to suggest that the vaccines will not be effective against these strains that have mutated. And then the question of whether the UK virus is really more transmissible is still somewhat open for discussion and debate. So we still don't really know.
Yeah, I would just add that I completely agree with everything Anthony Harris has said in response to this question. I think we're all a little concerned and we're trying to exercise caution with regards to the new strain, but so far it appears that the tests will still work, the treatment will still work, and the vaccine will still work.
Great, thank you so much. In regard to the COVID timeline, the first question would be, how long until we get vaccines?
So this is one, unfortunately, I think you guys could probably answer as educated fashion as John and I, in the sense of we really don't know what the change in government is going to do to distribution. We don't know how fast the states are going to get it. And to be honest with you, they have a complicated algorithm of who's going to get it in what order, but I think that could change as more vaccines are approved. I think the question, if I could reword it, that's probably of most concern to the students would be, are my teachers going to get it during the spring semester? And am I going to get it during the spring semester? I would hazard a guess the answer to the student question is almost certainly not. I think it's very unlikely the students will get it at any point before this summer or next fall. relative to the teachers, I think it depends a little bit on what age categories and risk factors they have. But I think that the semester will be well underway, meaning, you know, the first couple weeks of February, most of the teachers will be unlikely to have received the vaccine. Will some of your teachers likely have been received it before the semester is over? Yes, I definitely hope so, as we ramp up vaccine distribution. And I think as a couple more vaccines are likely to be approved by the FDA, I would say I'd say about a 10 or 15% chance that hopefully all your teachers will be vaccinated by the end of the semester. The problem that's going to arise from a policy point of view is what percent of teachers are going to accept the vaccine, and are they going to prioritize elementary, middle, and high school teachers before college teachers? And I think the answer to the latter is likely yes. If that's the case, then your teachers probably will be at the back of the line relative to teachers.
Yeah, I would agree with this. I think the only thing I have to add here is that even if MICA students, MICA staff, teachers do not receive the vaccine, there can be potentially positive spillover effects from increasing vaccination as the spring moves forward. The more people that get vaccinated, the fewer there are who are susceptible out there in the community. That means every infection has fewer potential targets that it can pass the infection along to. And that means hopefully by February, March, we'll see the numbers decline statewide, citywide, which makes us all safer.
Thank you so much. And our next question will be, how long will we have to have COVID measures? So like wearing the mask, limited travel, etc.
Can I start this part? Because I'll get to. So a lot of the time, what draws media attention is the, you know, expensive things and the big ticket items, right? So if you look at the media, a lot of focus has been on vaccines, right? Or expensive monoclonal antibodies. If the students only listen to 15 seconds of this session, I would say this is maybe the most important part. Wearing the masks that MICA is providing to you is the most important intervention to the safe reopening. And basically, we won't get into how it's spread, but the mask basically is the most efficacious. Some people think the masks are likely even more efficacious than the vaccine at preventing the spread of COVID. So the short answer to your direct question is you're definitely going to be masked for the whole spring. And I would hazard a guess that in the fall, there may be some aspects of mask use still being used in certain instances unless we have 80% of the community vaccinated. So the most important thing you can focus in on is wearing a mask properly, which means it covering your mouth and your nose, and then maintaining a proper social distance. But, you know, if you look at the hospital, just to illustrate the point of why the mask is important in the hospital, right? We have healthcare workers taking care of people with COVID all the time. The COVID patients cannot keep a mask on a lot of the time, so they're excreting virus. And in instances where the healthcare workers are wearing the proper protection of masks, their rate of becoming positive is no higher than anyone in the community. And in fact, most of our healthcare workers that have become positive, they've not become positive from patients in the hospital. They become positive from when they're not wearing a mask and they're eating lunch with their colleagues in the team room, or they're not wearing a mask and they're in the community in their grocery store or supermarket, or they decide to have a New Year's Eve party or things like that. It's all when even bright healthcare workers let the things they know work lapse and don't follow those aspects.
Yeah, I think it's impossible to predict how long we're going to have to keep all of these precautions in place. I think we can probably anticipate that all of us will need to be aware of the risk of COVID throughout this entire year. But hopefully by the fall, things will start to loosen up a little bit in terms of interacting with each other in person. But boy, I think that this pandemic has been so surprising. essentially every month up till now that it's impossible to say for sure. And I think it's going to be on our minds, regardless of what the restrictions are in place.
Thank you. I'm gonna pass it off to Andy for the Q&A section.
So we have some questions that were sent in, like, for example, one thing that I think would be a good thing to start is, can you address some of the common misconceptions that there are about COVID? If there are any that you can pick up.
John, you want to start?
Yeah, I can try to take this one. I think I was probably thinking of this question when I made my comments earlier, that I think a common misconception is I feel fine and therefore, it's probably going to be okay if I go to the gym or if I attend a birthday party. The truth is, even if you feel perfectly normal, completely yourself, unfortunately, there are many people who just don't realize that they have an asymptomatic infection and can spread this illness to others. So that's the main misconception I wanted to address. The truth is, I think earlier in the pandemic, there were a lot of crazy things that were coming out in the news, and most of those have been debunked by now. I'm talking about bleach.
I think one controversial area, I wouldn't call it as a misconception, but maybe we can touch on to reassure you that Scott from your MICA group is handling really well, is the issue of how long does it last in the air and what are ways to basically decrease that transmission through the air. So just in general, just to keep it simple, most of the virus is transmitted through what's called droplet transmission, which basically means you have to be in a close space with someone who's excreting virus, and the virus has to make its way basically to your mouth or eyes, which is why in essence, if two people are masked, even if they're within 6 feet, that dismisses a lot of the transmission. Now, some of the misconceptions relate to, okay, if I go into, let's say, a studio at MICA, after someone was in there 24 hours ago, can I catch it from the airflow? And the short answer is no, exceedingly unlikely. Now, so that ties into this whole issue of what's called airborne transmission. And just in general, the simple thing to relay is that if you're wearing masks, that handles 98-99% of the potential transmissions. The ways to destroy or cut down the airborne transmission, which MICA is handling, it relates to making sure that the air flow is good in all the teaching rooms. So there's complicated formulas about how many airflows you have to have per hour, and they're taking care of all of that. The second aspect relates, so that's the aspect of the more air exchange, the better. So as an example, for the 100 students living on campus, if you can open up your windows, that's a good way. It increases the air exchange and allows, if there was a minimal amount of virus, as John alluded to, from an asymptomatic point of view, that your roommate may be shedding, of having it out. The other thing that MICA is handling is a filtration system, is you can filter virus as well on the way in. And all those aspects are being handled. The policies have been reviewed. And to reassure you, we have a really senior and skilled infection preventionist, Joan Hebden, who's been touring all of your facilities to try to optimize the safety of the students and the safety of the teachers. So they've been to the dormitories, they've been to where you're going to be eating, all kinds of ways of designing them to help both with visual cues of, okay, how do you keep people separated in the studios, and all the aspects that are needed to help decrease the risk of transmission.
I think just to build on what Dr. Harris was talking about there, one other misconception that comes to mind is we talk a lot about ventilation, and certainly the best ventilated air is outdoor air. But just because you're outside doesn't mean that you can sort of slack off or drop any of the other requirements for physical and social distancing and mask use, because really the majority of transmission is to people who are close to you, when you breathe or speak, large respiratory droplets, saliva droplets go from your mouth to someone who's 2 or 3 feet away. Even if it's a windy day, the wind is not going to be able to pick up all of those particles before they reach someone who's close to you. So it's still important to keep a mask on even when you're outside.
Awesome. Thank you. Another question we have is, at what point in the next few weeks do you predict that Baltimore will begin to open up past its current lockdown phase?
That's a very good question. I'm probably not going to try to predict what the local government is going to do. So one of the questions I think we got is about what models we're looking at when we try to estimate the sort of course of this pandemic moving forward. The university does have internal models that we use to sort of predict the overall curve of the pandemic, and they suggest that the numbers are going to plateau over the next week or two and then start to decline around the end of January. But it's up to the politicians to decide sort of how to respond to those numbers, and I understand if they choose to exercise caution and move slowly because of how bad it's been this winter.
How do you predict that, or I guess how will gatherings be restricted within the dorms on campus this semester, following it with the line of things reopening?
I think that one's mine, because that's about sort of how Mike is going to work through this stuff. I doubt the doctors want to get into that level of granularity with Micah. They've gotten to know us really well. I don't know that they want to get to know us that well. So there's several things here. So I can answer this much broader than just the residence halls, because people gathering in ways that are compliant with what we're asking or non-compliant is a potential issue across campus. And the first thing, as we all know, and has already been said a couple of times, is that there's a tremendous amount of individual social responsibility every single one of us is going to have to bear. The reality is there's no scenario where we can 100% eliminate risk. We can greatly minimize it, but we cannot 100% eliminate it. And there's also no scenario where we can have campus safety or other sort of officials' eyes on every single corner of our campus. That's just not plausible, nor frankly would we want it. So every member of our community that's coming back to campus, I mean, frankly, every member of our community, no matter where you are across the globe, but within the context of this question, every member of our community that's coming back to campus is going to have to buy in and own their piece of playing along and doing what they need to do, not only to protect themselves, but protect each other. Some things that you all won't know because you haven't yet been where someone could gather. We have considered, reassessed, and come up with new limitations on how many possible. So since the question was about the residence halls, take one of the gathering rooms in Lee Hall. The space is limited to no more than 3 individuals or 4, depending upon the size of the space. And by the way, all that extra furniture removed. Does that mean we're 100% preventing 8 other people coming from sitting in and sitting on the floor? Of course not. But that's where we need folks to comply. We've assessed everything. We've recapped everything. Even the elevators have limitations of no more than 1 or 2, depending upon the size of the elevator. Yes, in residence, we will have a handful of RAs who will be helping our residence life staff, who will be helping. Campus safety is here. We'll have leaders all across campus who are working to try to help remind folks and make sure that we're all doing what we need to do, frankly, in following the guidance of the social agreement. But it's going to need to be led by individual accountability. And then Micah has done everything we can to set the conditions for folks to make really good decisions. So we're being very clear about mask usage, about social distancing, recalculating how many people can be in classrooms, guest rooms, meeting spaces, elevator spaces, even the entrances and exits of buildings have been recoded so that they're one way. So for example, in Bunting, you come in by the front door, where the guard desk is, where postal and print is, but you exit by the parking lot. And we've done that in most, if not all of our buildings, because we really need to minimize density. And one way to do that is to have stairwells be one way, hallways be one way, and to make sure that we've got as much gap as we can. And frankly, that we're not so subtly reminding everyone with every moment they're on campus that they really do need to pay attention, and we really need to do this as a team lift.
Thank you, Mike. I'm just trying to find the next question. I believe we're at, how does Micah ID who will be tested weekly?
So that's another one for me. So and that's fine. There's several ways. So first of all, if folks haven't read the granularity that came out in our recap last Friday, IDs are only going to be active for those individuals who have returned to social agreement. So if you don't return to social agreement, your ID is not going to be active, you're not going to be able to get around, and campus safety is going to turn you away. For those who have already filled out and returned the social agreement, first of all, thank you. But you may remember that as part of returning the social agreement, there's actually a box that indicates, do you expect to be on campus once a week or more? So that's our first step. So we have folks self-identifying who's going to be coming in weekly and therefore needs to be in the weekly testing program. But we're not taking that solely at face value because there's several other data points we have, inclusive, of course, of our residential roster. We know exactly who those 100 students are. But if you continue the thought, all of our graduate students and seniors who will be using independent studios, for example, we know who they are. We have those rosters. So we're able to use those to back check and cross-reference and make sure that the social agreement lists and who self-identified to social agreement are complete. Or by the way, we're doing the same with employees as well. We've had all area managers. So for example, I in the Division of Student Affairs, I've had to identify every member of my division team who may be coming to campus weekly or more, or even coming to campus just sporadically. So we know who's coming and going. We have a sense of how dense our campus is going to be, and we can track accordingly. And then finally, because I don't want to spend too long on any of these, but finally, and this, at the risk of always brushing up against the big brother pieces that we all worry about, right? I mean, I think that's a very real piece, but the reality is we are able to see and track who's coming in and out. That's what campus safety is there for. And we'll be able to, so if someone's ID is active, but they're active and telling us they're going to be a sporadic user coming to campus once every few weeks. But the reality is we start seeing their ID being used every other day. Then we're going to know that they've not been upfront with us. We're going to be able to address them and work with them and understand what their campus utilization is and make sure that they're being tested appropriately. It's a great question.
Thank you, Mike. Okay, it keeps shifting, so I'm just gonna pick one. In other words, in relation to our direct situation, do you foresee Micah needing to move to operational mode 2 in the next few weeks?
So we discussed this a little bit last week, and we think, in short, the answer is definitely no, for the following reasons. We think that with only 100 students coming on campus, right, and it's the students, and then we have some of the Baltimore City graduate students coming to the studios, we think that the ability to stay in operation mode 3 is very high. So it's not like the campus is opening with tons of in-person teaching. So we feel confident that the current plan that's set up will allow us to stay in operation mode 3 for the whole semester. I think the part that we want to talk about that ties into Mike's social responsibility is the positivity rate in the city and the metrics in the city and the state are likely to get worse the second and the third week of January, just when Micah is opening. But if the students listen to this and take all the information that Micah is disseminating and start behaving properly from this date onwards, there's no reason why MICA can't be very, very safe in this surrounding area of worsening metrics. And that's what we're aiming for. So as Michael alluded to, testing is going to start January 19th. And the hope would be that that testing data is going to look very good because students have been behaving and following the rules and regulations, and that the MICA metrics that we will be following, which is the, things like the testing positivity within MICA, how many students are becoming positive, how many teachers are becoming positive. We are hoping those metrics will look very good last week of January, first week of February, second week of February, when we know that the Baltimore City and state metrics may not be so great.
Yeah, I hate to hammer on here or pile on too much, but I think Dr. Harris and Mike have hit on probably the other most important thing that we wanted to reinforce in this session, which is we all want MICA to have a successful spring semester. And the most important thing in terms of ensuring likelihood of successful semester, access to on-campus services, is going to be preparation and execution of protecting ourselves from risk of infection. And so that means if you're someone who's planning on coming back to campus, you might decide to isolate yourself at home more than you would normally in the week or two leading up to your return to campus. If you're someone who's already in Baltimore City, schedule yourself to get tested as early as possible. And while that test is pending, while you're waiting on the results, try to isolate yourself at home. You're still going to be doing the same things once you have a negative test result in terms of wearing a mask and maintaining physical and social distance. But in the time leading up to that first test, consider taking extra steps to minimize your overall risk. Because if everyone on campus is negative, then the risk, at least in the MICA bubble, is going to be much less than the surroundings. And sort of all of you, and to a lesser extent, Anthony Harris and myself, are in it together in that regard.
And actually, I want to jump in on this for a second if I can too, because I'm very aware that the last image that anybody on our campus really has, certainly our students and our faculty, is back from spring break. And in the course of a couple of days, it went from we're not sure what's going on to go home and don't come back. It was abrupt, it was incisive, and it was really hard on, frankly, everyone. Some of that was following what the state was telling us, but some of it was also no one had any idea what we were dealing with. And we have tremendously more information now. Thanks in part to Drs. Baghdadi and Harris, but also because the field has just been looking at this and studying this for some time. We've seen other schools open up and be successful. We've seen other schools open up and not be successful and learn those lessons too. But one of the big things that it's really going to be, I hope will be useful for folks to think about is, we now have all sorts of grayscales that we can work within, right? So the odds of us having to go from opening up in operational mode 3 to things start going badly and 2 days later, hey, everyone go home, are so far out there as to really not even be on my particular radar screen. Unless the government comes in, Governor Hogan, for example, comes in and intercedes. But we have so many levers we can pull that are less than go home. Even if it is, you know what, we're going to shut down independent studios for a week. We're going to try to get it, sort of quiet the campus for a week or 10 days or 2 weeks to ride out a spike in the area, a spike in our internal metrics. But then assuming everything goes well, then we resume, 2 weeks down the line, we're back and up and running the way we opened. We're going to have vehicles like that where we can work in much smaller and more incisive ways rather than just it's either open or closed. And just to give one more bit of specificity there, for those who paid attention to what came out in recap last week, we've already started acknowledging some of that and doing some of that. So for example, The fitness center, which we expect to be open the majority of the semester, will not open until week 3 at the earliest. And that's specifically so we can ease into the semester a little bit, get other pieces up and running, focus our attention in other spaces for the first 2 weeks, and then bring another item online. And then if we need to take it offline for a little bit of time later on down the road, or delay and it opens in week 4 or week 5 instead of week 3, all of those things can be done. We've got a lot of different ways we can approach this if things don't go the way we want them to go.
Thank you. So we only have about 5 more minutes left in this section. So we only have time for one more question. And I lost it. Basically, it's asking if Micah will be providing testing and if they'll be testing for the antibodies or just COVID in general. So if you could speak to that.
So yes, we've talked about the testing a little bit already. We will be having testing housed out of B-Box on Mondays, Tuesdays.
Wait, did I say? I meant the vaccine. I'm sorry.
Oh, so vaccine. Then
yes.
I will stop talking because we haven't talked about vaccine yet. Doctors, I mean, it doesn't sound like we know a good timeline on when vaccines would even be widely available.
I think it's too early to prognosticate that. I mean, I think that chances are by the fall, pharmacies will be distributing the vaccine to students and there'll be multiple options, but the chance of students getting a vaccine this spring, I think, is very, very low to non-existent almost.
Yeah, I think CVS is a key part of Governor Hogan's plan to get as many people vaccinated as quickly as possible, but that's going to come later.
Okay. Well, since that one was short, I could ask another one. What are the negative consequences of the current vaccine? And is the new, I guess we sort of already covered it, but if the new strain is covered under the vaccine?
So negative consequences are very small compared to the risk of COVID, but basically there are side effects to the vaccine. So at present, there's 2 vaccines available, both are 2 doses. With the first dose, the symptoms are extremely mild. So about 70 or 80% of people have no symptoms at all. 20 or 30% just have a sore arm, some fatigue. With the second dose of the vaccine, about 50% of people have symptoms. Can range from sore arm, fatigue, shakes, chills, low-grade fever. But here's the bottom line. I would much rather get side effects for 12 to 24 hours, which is what is happening with the vaccine, than the side effects of having COVID, which can last months on end, or even just the virus itself causing at least, a week of symptoms in a lot of college students. So if you look at the tail of the tape, right, of what the problems are with the vaccine and what the benefits are versus what the problems are and benefits of COVID, I mean, it's just an absolute slam dunk that anyone who gets offered the vaccine should be first in line to get it. I mean, that's how we're going to get ourselves out of this.
The only things I would have to add here are if you are someone who has a specific concern, maybe you have a history of a severe reaction to vaccines, or you may be planning to get pregnant, now is probably the time to get in touch with your doctor. If you don't have a primary care provider, you may consider signing up with one so that you can have these discussions in advance, so you sort of know what your plan is going to be as soon as vaccines do become more widely available. And we hope that in the months between now and then, there will be even more data showing the safety of these vaccines. And if, these comments so far have not been convincing, I can say that both Anthony Harris and myself have been vaccinated, and we're doing fine.
The other thing, just from a pure numbers point of view, in the trials, right, there have been 60,000 people vaccinated. And then, as John probably knows these numbers more than I do, but if you look at how many people in the country have been vaccinated in the last 3 weeks, I think it's over 5 million, right? 15 million or something. Most vaccines, when they have side effects, vaccines occur within, 5 to 10 days of the vaccine. So now we're talking a really, really large sample size. So we should have already seen any possible vaccine side effect that we would have gathered at this point. And in some ways, I think a lot of you at MICA, you guys are at a really special institution, and part of it being a special institution is you're in the middle of Baltimore City. It's kind of our responsibility to kind of bring the community along. And there's going to need to be a lot of convincing, unfortunately, of people who benefit the most from the vaccine, of convincing them to get it. And the safer the community is, meaning the more 50, 60, 70-year-olds in the surrounding community that get the vaccine, the safer it's going to be for MICA students as well to go full speed ahead next fall, which is what we're really aiming for.
Thank you very much. So we're going to move on to wrap up. I'll shift it over to Sophia.
Okay. Hi, everyone. Sorry. Let me turn on my camera really quick. I wanted to say thank you very much for the doctors here for taking your time for letting us know, and also thank you, Mike, for answering some of the MICA questions. The students and the SVA appreciate the questions and all the hard work that is going to have a normal kind of ish semester, but you know, it's still a long process, and we thank you all for their hard work. And I think that it's a wrap up, and thank you so much for those who joined in, and those who are gonna watch the video on our YouTube channel. Thank you so much. Goodbye, everyone.
Thank you, SVA.
Thank you.